Hello and welcome to another in our series with Medmin sponsoring. And today I'm very pleased to introduce back again Dr. Jackie Radley. Hi, Jackie.
Hi, Catriona. Lovely to be here with you again.
So today we're going to talk about menopause focused again, but this time about HRT. And it's like whether you have HRT or not HRT, because I think that it's so prevalent out there. And for a lot of people, HRT isn't an option they can take. Also, along with perhaps maybe the stigma of saying, well, I don't want HRT. What else is available? And this is what we're going to talk about today with Jackie. So, Jackie, first of all, if you'd like to just introduce yourself a bit more formally than me just saying, hi,
Of
Jackie.
course, yeah. So, yeah, I'm Dr. Jackie Radley. I'm a GP and a menopause specialist accredited by the British Menopause Society, and I'm the founder of the Birmingham Menopause Clinic. So, I'm a menopause doctor. I see patients in the NHS and privately.
Thank you. So, HRT, when people come to you, I don't know, is the majority say I want to go on HRT, or are people saying, what, I've got these issues, these symptoms, what would you advise?
So, to be honest, I think the vast majority of women that come to me want to go on HRT. They're usually at a point in their journey that they've sort of maybe tried other things. They've tried over the counter herbs or supplements, or they've tried all sorts of things. And by the time they come to me, the majority of women are coming because they want to be prescribed HRT. But uh, there are women that do come to me that maybe they can't take HRT for medical reasons. So they might be on active treatment for breast cancer. They may be having vaginal bleeding that needs to be investigated. There are some medical reasons not to be given HRT. Sometimes they're temporary reasons, but reasons nevertheless. And then there are also women that really don't want to have HRT. They might be just not want to have hormones. I've had women say that, well, I've been on the contraceptive pill all my life. I don't want to start taking hormones again now. And sometimes we'll have a discussion, and so women might be worried about having hormones. They might just not feel that it's not natural to have hormones, or they might be worried about the perceived health benefits that they might have read in the media. And so we tend to have a conversation so that I will address any of their concerns, because sometimes they'll be worried about HRT and their worries are unfounded. But for women that really don't want to take HRT or can't, then of course there are lots of other options available to sort of help with the symptoms, but also help with long-term health as well. So it's really important that women are aware that if they don't want to take HRT or they can't take HRT, that there are things that we can help them with.
Mm. And I suppose one of the problems with HRT is that it's quite, there are so many symptoms associated with it, and it's hard to know whether the symptom is if it's HRT, sorry, no, it's the menopause, or else it's another chronic condition. So I know that, speaking to a lot of patients that have a range of chronic conditions, quite often, for example, if it's MS or something like that, people say, oh, that's your MS. And it's like, well, no, it's not my MS. I think it's the menopause that's causing this issue. Do
Mm.
you find you find those issues?
Yeah, I do. I mean, I'll have a lot of women that will come in and they'll say a lot of it will be that they've been told that they're depressed, or yeah, if they've got a
Mm.
chronic condition, then maybe they've got osteoarthritis, and well, your joint pain's due to that. I think when we're trying to work out whether it's a menopausal symptom or not, often ask lots of questions or get a woman to fill in a menopause questionnaire, which there are so many symptoms of menopause, and what it's almost like a detective um, game trying to work out what's going on and unpicking everything. But if a lot of women that do a menopause questionnaire, they might think, oh, well, I haven't got many symptoms of menopause. But when they actually fill it in, they realize that they have a huge amount of symptoms. And it's when we get those sort of cluster of symptoms together that we can put the picture together and work out what's causing the symptoms. But sometimes it is difficult. So with people with chronic conditions that have got symptoms and that we're not sure whether it's menopause or it's that other condition, then sometimes we just give a trial of HRT for women who want to take HRT to see whether it works and whether it helps their symptoms or not. So that's sometimes one way of working out what's causing symptoms.
So what are the things, so if you, okay, I don't want to go on HRT for whatever reason, what are the sort of first things that you would suggest people look to take?
I guess there are, I think there are a few things. So there's lifestyle advice is really, really important. And then there are medications that we can prescribe that will help with symptoms. And then there is also some talking therapy, well, there's sort of psychological therapies like CBT and hypnotherapy. So it's often a combination of things that we'll use. So because HRT replaces estrogen, so it's menopause symptoms are caused by lack of estrogen. Because HRT replaces that, it'll often help with most of the symptoms. But if we're looking at using a non-HRT management, then we'll often be looking at individual symptoms and seeing, well, how can we help with that particular symptom? So if a woman's main symptoms are lack of sleep, it's like, well, how do we help with sleep problems? Or if they've got hot flushes, it's like, well, how do we help with hot flushes? And we have to sort of zoom in on that particular symptom and treat it, each individual symptom. Sometimes we can cover a few symptoms with one medication, but not in the same way as we can with HRT. So I guess medication-wise, the first line for women who can't take HRT, if they want to take a prescription medicine, there are certain antidepressants, and women often don't like the thought of being on an antidepressant, but we're prescribing it specifically for hot flushes and night sweats. There are certain antidepressants that have been shown in research to reduce the severity and the frequency of hot flushes and night sweats. So they can be really helpful. And a lot of women who maybe are on breast cancer treatments will be prescribed one of those medications. We have to be careful which ones we give, because there are a couple that can't be prescribed with tamoxifen. So if women on tamoxifen for breast cancer, then there are a couple that we can't prescribe, but there are ones that we can. But so antidepressants are helpful because they help with hot flushes and night sweats, but they then also have an effect on anxiety and mood if they're a factor, and they can also sometimes help with sleep. So that's one. That's probably the first line of non-prescription medication. There's also a medication called oxybutynin, which is for an overactive bladder usually, and there is research to show that reduces hot flushes and night sweats in some women. But also if a woman's having urinary symptoms as well, it can help with the hot flushes and night sweats and the sort of urinary problems. So that can cover a couple of things. With oxybutynin, it can affect memory and cognition, so we tend not to give it in women over 65. So we need to be careful. It's suitable for some women, but not others. And then there are a couple more. There's clonidine, which has been used for a long time in menopause, but it doesn't have great evidence. But some women do find it helps, and that's a medication that was originally used to treat high blood pressure and migraine, but it has been found to help with hot flushes. And there's a couple of other medications called gabapentin and pregabalin that I don't tend to use very often for menopause, but they can help with hot flushes and night sweats. But they are controlled medications, which means that they've got the potential for dependence, so they can be difficult to come off. So their licensed uses for use in epilepsy and nerve pain. So they're usually sort of something that we keep in reserve if nothing else has helped.
So would they be prescribed as off license, so to speak?
Yeah, they would. So clonidine has got a license for menopause symptoms for the hot flushes and night sweats, but the other ones are all off license. So it means that they've been licensed for another use, but they've been found to be helpful and safe for use in another condition.
And would that sort of be, it would have to be from someone like yourself who specializes specifically in menopause, as opposed to sort of your standard GP would know that or would prescribe it?
So some GPs will prescribe antidepressants because they're very um, confident and comfortable prescribing antidepressants because they prescribe them widely, for other conditions. It very much depends on what sort of background your GP has, um, whether they've got much of a background in menopause, because obviously GPs have to know about everything and their specialty may not be menopause. Some GPs have a more background knowledge in menopause than others. So it sort of depends. But the British Menopause Society do have a list of non-hormonal medication that can help with menopause, so which is available online. So GPs can prescribe some of those medications.
Okay, I'll have a look for the link for that, and we'll put
Yeah,
it in the notes for sure.
yeah, because it gives useful information. There is another medication that's been developed that's actually licensed, that is licensed for hot flushes and night sweats, but at the moment it's only available privately. That's a
Mm.
medication called Veoza or fezolinetant. You may have heard that in the media, but it's been developed. Um, but it costs about £65 a month.
Oh wow.
It's been licensed. It's being looked at by NICE at the moment to see whether it can be used in the NHS, but it's not available currently. And
Mm.
it's a non-hormonal medication that works on the thermostat in the base of the brain, which is responsible for our sensitivity to changes in temperature. And when we go into menopause and our estrogen level drops, that thermostat in the base of the brain becomes very sensitive to changes in temperature. And this new medication helps with that, helps modulate that.
Right, that's interesting. And then, the other thing is, and people, I'm sure you get asked this all the time, what do you feel about supplements? There's lots of supplements and vitamins and all of those things for menopause. Do you think they help or?
Yeah, and there isn't there isn't a lot of evidence. So the evidence for sort of certain herbal remedies is, and just because we don't have the evidence doesn't mean that they don't work for
Mm.
some women. But we don't have huge trials like we have. There are big trials for most medications that we prescribe, but with herbal medicines and supplements, there's often it might be there might be very small trials, and the doses might differ, and the populations might not be controlled in the same way. So the evidence isn't as strong as for the medication that we prescribe, as doctors. But that's not to say that they're not. Some women do come in and say that they've tried certain herbal medications that do help them.
Mm. No, that's sort of
And
good to know, isn't it? Because quite often you want to try it yourself, and it is about testing everything, isn't
yeah.
it, to work it out.
So the best evidence, and according to NICE guidance and British Menopause Society, is for black cohosh, and also red clover. Those are the two herbal supplements, but they're not safe for women. If you have a history of breast cancer, or you having treatment for breast cancer, it's better if either you're going to take any supplement or a herbal remedy at all. It's better to it's a good idea to speak to your breast surgeon or oncologist, because then they can interact with medications that you're on, and also they have estrogenic properties, so they're weak sort of plant-based estrogens really. So you do need to be careful, and just because it's a herbal remedy doesn't mean it's completely safe.
Yeah, I think that's the main thing, isn't it? Is you
Yeah.
just don't know because they're not governed as the
No,
same as medication at all.
no.
Thank you. So, the good news is that there are lots of alternatives. But
Mm,
once again, whether you're on HRT or not, it is looking at lifestyle can make such a huge difference to when you're going through the the menopause period and beyond, because it's not just that small amount of, I say small amount of time. I mean, menopause can go on for years, but as you get older, you're still with those symptoms and still need to look after yourself.
Absolutely, absolutely. So I think menopause is a really good, when you're going through menopause, it's a really good time to sort of look at lifestyle. And I always talk about lifestyle in conjunction with whatever other treatment we use, whether that be HRT or not HRT. But lifestyle is the most important, really, both for help. Having a healthy lifestyle helps with menopausal symptoms, but as you say, it also helps with our long-term health. It helps protect our bone, protect against osteoporosis, protect our head, our heart, our brain, every and our mental and physical health. So a healthy lifestyle is really important. What we know about menopause is that we undergo a metabolic change when estrogen levels drop. So we start, unfortunately, to lose lean muscle, and we also tend to have a tendency to put on fat cells. And what happens is when estrogen level drops, our body wants more estrogen. We want to maintain the status quo, and fat cells make a really weak form of estrogen called estrone. So we have a tendency to put on fat often around the middle and around our organs. And so that accompanied by the loss of lean muscle affects our metabolic rate. So the more lean muscle we have, the higher our metabolic rate, the more calories we burn. So if we lose lean muscle, then our metabolic rate goes down. And then we've also got the addition of fat cells being produced. So it's sort of a bit of a vicious circle for weight gain. So there are ways to counteract that. And so we always recommend sort of a healthy Mediterranean diet with whole foods, avoid processed foods and ultra processed foods, have plenty of fiber, but also like having enough protein. Having some protein in every meal is really important to help with that, to maintain our lean muscle. And then the other thing to do is some strength training at least a couple of times a week, and that can help maintain and even build muscle. And that's really important for our metabolic health, to prevent weight gain, but also for to prevent frailty when we get older. Going through the decades. So doing some strength training is probably one of the most important exercises that you can do really for health. And then we also think about bone health and reducing osteoporosis. So having enough calcium in your diet. And I can send you a link to a calcium calculator that I send to women.
Yeah.
Because it's better to get it from your diet than from a supplement, because we absorb it better. And then vitamin D, especially during the winter, because we make our vitamin D most of our vitamin D from the effect of sunlight on our skin. So if we're indoors a lot during the summer, or we should take it all the year round, but vitamin D, especially during the winter. So that helps with bone health and prevents osteoporosis. But also some weight-bearing exercises any weight-bearing exercise is good for our bones as well. So, I mean, a lot of the advice for menopause and lifestyle is the same for everyone, really. But that protein and strength training is particularly important.
And I think it hits women harder because it's just suddenly, it is a sudden thing. You suddenly go into that, your body is completely changing. Whereas for men, it's sort of slightly different. And, as they always say, youth is wasted on the young, or whichever way it goes around. You get older and you suddenly realize, oh my goodness, I've got to learn, because your body, when you're young, you don't realize the damage you could be doing because you're young enough to counteract it.
Yeah, I mean, there's an awful lot to take on board to keep us healthy as we get older. And it's constantly doing small things, really. You don't have to do everything perfectly, and we don't have to do everything at once, but every little helps, really. Every little helps. Anything that we can do to improve our lifestyle is worthwhile.
Absolutely. Well, thank you very much for your time, Jackie. It was great
You're
talking to you
welcome.
again. Thank
Lovely
you.
to speak to you as well. Bye-bye.
Bye.
Bye.